hypertension in children. So this one talks about introduction to hypertension in children. Okay, so the thing just opened anyhow, so I'm just doing it based on what I see. If not, this video would have come earlier. So introduction to hypertension in children. First of all, you should know that it's blood pressure at or above the 95th percentile of age, sex, or height. Okay, so it can be primary or it could be secondary. Okay, so I'm just replying somebody. So teenagers is when you now say the blood pressure is above 130 over 80 mmHg. Okay, so types is primary hypertension, where there's no identifiable cause. Do you understand? It's just linked to some natural things like family history. It just runs in the family. The child is overweight. Do you understand? The secondary hypertension, this is when you say that the hypertension has an underlying cause, like kidney disease or heart defect or hormone imbalance. Do you understand that kind of thing? You can pinpoint what is actually causing the hypertension. So risk factors, just like we have listed some of them, include things like obesity, sedentary lifestyle. The child is not doing all those exercise. The child is just sitting down in one place. Poor diet. So you are eating food that has a lot of salt. Okay. Then family history of hypertension. Hypertension runs in your family. Okay. Then prematurity or low birth, chronic kidney disease, or congenital heart disease. So most children with hypertension are symptomatic, but if it at all shows any symptoms, you have things like headache, dizziness, okay, fatigue, visual disturbances, then nose bleedings. Okay, that's epistaxis, but epistaxis is quite rare. Okay, so diagnosis is just routine screening. Once the child is from 3 years, you routinely screen them. Ambulatory blood pressure monitoring, then use the right curve, use the right sphygmomanometer to measure blood pressure. Investigations, you go in for blood tests. Okay, look at the kidney functions, the electrolyte, the glucose levels, urinalysis, renal ultrasound, echocardiography, hormonal assays. This one is mostly done when you are trying to rule out or rule in secondary causes of hypertension. Management is lifestyle changes, the first line. So the child has to change the food they eat. Low sodium, they should eat a lot of fruits. Okay, reduce salt intake, eat a lot of vegetables. Regular physical activity, manage their weight. So medications is when the lifestyle changes have failed. You use drugs like beta blockers, diuretics, angiotensin converting enzyme inhibitors, then angiotensin receptor blockers, and the rest of them.